everybody. I'm Dr. Jonathan Abernheim. I'm here with the famous David Giosa. He's been my patient for how many years? 10? Since we started?
Since we started, day one.
So David is one of the most, I would say, dedicated patients that I have. He really takes care of his mouth. It's very important for him. I would say the first major thing we did was we changed a smile, right?
Right.
We did your upper teeth. How was that? Feel like it changed your life?
I don't have no regrets.
No regrets.
No regrets at all.
You're able to smile.
It's very well spent money. I'm not used to people telling me I have nice teeth.
So that's awesome.
Yeah, no, it's very
So
happy.
how long have you had your new smile for?
Oh, at least a couple years.
A couple of years,
right?
maybe, I think 3 years, maybe.
Something
3
like
years,
that nature, yeah.
So for a long time, David had, he had this clenching issue with his teeth, and he had these areas of his gum, specifically on the lower, where you were losing tissue, right?
That's correct.
And again, he was my patient for 10 years. We had nothing really that was predictable, that was easy, that wouldn't really cause that much pain to our patients. So we really never recommended anything. So we developed this procedure. We call it Pink by Jonathan. And David was one of the lucky recipients of having that done. So that we're at what, 6 weeks?
We're at 3 weeks right
3
now.
weeks.
3
Oh,
weeks, yeah.
you look so good. I think it's 6 weeks. So tell me, so how do you feel? How did it go? Do you feel like it accomplished what you had now that you were at 3 weeks?
Yeah, it's quite amazing how much the tissue grew back. To my surprise, it's for the most part, the first day or two was slightly uncomfortable. You had to take a couple of leave, maybe at night to go to sleep. That was worst case scenario. And then, the most difficult thing I feel would be is just adjusting for the first couple of weeks to your diet. You have to eat something pureed and not put pressure on the gums. That's the challenge.
So endorsement Vitamix?
For me, I have a Vitamix, so I was able to just eat tons of fruits, vegetables, proteins in a pureed form, and I was able to, it actually worked out really well.
It's awesome. So for David, we put some stem cells into his gums, some collagen into his gums. We were able to grow it back. It's still healing really nice. He sees us at 24 hours, at 1 week, at 3 weeks, and we'll see him again at 6 weeks. And it's really an amazing procedure. We think of it as resetting the clock on your gums so that your teeth can stay there for as long as they possibly can, and hopefully for the rest of your life. And we were lucky enough, David let us do that procedure on him. And I think it was pretty successful to you. What do you say to somebody who has gum recession?
I've already recommended it to a few friends because they were going to go get the old technique of the sutures and all that.
Oh, okay.
So I spoke to them and told them what I've experienced, and if they don't do it, it's their fault. Yeah, it's their loss.
Well, there you go. You heard it from here, from David. I'm Dr. John. Thank you guys, everybody.